Okay, just want to welcome you all. I want to thank Olga Kelly from the Lafayette Ward, or Dr. Olga Kelly, who will be doing our Spanish interpretation tonight. And I'm grateful for her because she's a doctor and she's going to know the language better than most. So we want to thank Bishop Alph and also Dr. Alph for being here tonight to present. We're really excited to have him here. I'm just trying to, once again, if you have questions, we can put your questions in the chat and we'll go over those at the end of the meeting. And just a reminder to keep yourself muted. All right, go ahead, Dr. Weiss.
Thank you. I am excited to be here. I'm Alph Wise. I'm in the Lafayette Ward. Been here for 15 years now and love this area. Mandy's husband, Don Sherwood, is my bishop hero, and I've tried to emulate him as being a bishop, and I think I'm not living up to it, but I can talk about hormones, and so that's something that he can't. So I have that going for me, and I'm excited to be here to talk about this. I think it is a really important conversation to have. And so I'm gonna share my screen. I have a little slideshow that we'll do. And give me 1 second to get this. Okay. All right. So is that working? Do you see a slide there? Is that a burning in my bosom or a hot flash? This entire talk started because Amy, my wife Amy, and I thought that was a hilarious title, and because of that, now I get to do this presentation. So I do think we were talking about this in the car driving home from church on Sunday, and we were talking about this presentation, and my kids were like, "What? Why are you going to talk about hormones to church people?" And I said, "That's a good question." And the reason is because hormones are so important. They affect so much of how we feel and how our body functions, and not just physically, but mentally and emotionally. And we all will deal with hormone changes in our lives, all of us. And so it's just so important to kind of talk these things through and be more kind of aware of what's out there and what possible treatments there are and things to test. And so that's what we're talking about tonight. So the goal tonight is really to be better able to recognize possible hormone imbalances. So I'm a family practice doctor in Walnut Creek. I treat hormone imbalances. I treat both men and women with hormones. I've done some extra training in hormones, but I'm not an endocrinologist, and I wouldn't necessarily consider myself a hormone expert. This talk is really meant to be pretty straightforward and basic, so that we can all get kind of on the same page. There may be some of you out there that know a lot more about specific hormones than I do, and that's great. We all want to study up on this and be as knowledgeable as possible. The disclaimer is that none of this constitutes medical advice. You should talk to your own doctor about your specific things. And everyone is different. And so I can't tell you how many times I've met with a patient and we've talked about symptoms and we both come to the conclusion, this has to be low thyroid. And then we check the thyroid and it's totally normal. And so, yeah, sometimes it's not hormones, everybody's body's a little bit different. And then the other disclaimer is I will be using descriptive anatomical names, which is new for me in a church setting. So here we go. what are hormones? So hormones are chemical messengers made by endocrine glands that are produced and then released into the bloodstream. So they really go and send messages to different organs throughout the body, and they regulate bodily functions, and they control everything. We're going to talk about some of the most common ones. Because this was, I tried to think of examples of hormone dysfunction in the Bible because I wanted some cool story, and the only one I could come up with was probably Goliath, who had most likely a growth hormone excess, right? That gives a gigantism, and so that was my only one. There probably are more. That was what I came up with. So these are the hormones I wanted to kind of touch on tonight. Estrogen, progesterone, testosterone, thyroid, insulin, and cortisol. The first three are what we call our sex hormones. Sex hormones are made in the ovaries in women until menopause, and then they switch over mainly to the adrenal glands. But I guess some is also made in the adrenal glands your whole life, but that's what really changes at menopause is the ovaries stop making hormones. There are lots more hormones. This is our kind of basic list. There's hormones that control really every function. So what do? So estrogen has over 400 functions in the body. I think what really kind of gives that away is the fact that there are receptors for estrogen in your brain, gut, muscles, bladder, heart, lungs, eyes, blood vessels, breast, vagina, everywhere, skin. So that just shows estrogen is super important all throughout your body. It regulates temperature. It affects blood pressure. It affects mood and brain function. We'll go through a lot more of this as we see kind of what a deficiency looks like. The other thing I'd say is that all of these hormones have different functions. So the function of estrogen as you're going through puberty is different than the function when you're pregnant or when you're having your menstrual cycle. So those things, time changes and age changes what the functions are. Progesterone has a lot of important functions. Estrogen definitely gets all the attention. Progesterone is also really important. And it really is the balance with estrogen, and the way the two of those work together is important. And sometimes we'll think of it as a progesterone deficiency may actually look like an estrogen excess, you know. And so as those two come closer together, you know, but the symptoms of low progesterone looks a lot like the symptoms of high estrogen. Progesterone is really important during pregnancy. It changes during, it spikes during ovulation, and it's an important part of hormone replacement that we'll talk about. So what happens when your levels are off? And so low estrogen is the one where, you know, we think of a lot, right? These will be very similar to when we go through the symptoms of menopause. When you're over 45 and you have low estrogen, we call that menopause. If you're younger than 45 and you have low estrogen, then we talk about that as premature ovarian failure or primary ovarian failure. It just basically means that we were expecting those levels to go down after 45, but before 45, that's unusual. So fatigue, depression, memory, you can see how much it affects brain. Hot flashes we'll talk about. Menstrual irregularities. So low estrogen gives kind of diminished periods, whereas high estrogen will give heavy periods and more frequent periods. Low estrogen can cause vaginal dryness, vaginal itching, leading often to painful intercourse. bladder problems. So we talk about incontinence or more frequent bladder infections. It can affect the skin. So pale skin or dry skin, it can affect the hair. You can have thinning of the hair. We worry about osteoporosis with low estrogen. We know that estrogen is important in keeping your bones strong. Low progesterone. Low progesterone can give these feelings of being tense. So you can see, so if estrogen, one of the things estrogen can do is help with kind of a feeling of well-being. But if you have too much estrogen or too low progesterone, that can feel like irritability and anxiety. Low progesterone can affect sleep. It can give increased breast tenderness and swollen breasts. So that's the opposite. If you also get, say you got a birth control pill, or if you were given hormone replacement and it had too much estrogen, then you could also get breast tenderness and swollen breasts. And so that looks like the low progesterone as well. And heavy periods we talked about. The thing I'd say with low progesterone is that this is one that doesn't get talked about a lot. And I see a lot of women kind of starting in their 40s that can have symptoms of low progesterone. And so my wife, Amy, has given me permission to share this. But this was something that she dealt with, and it showed up as in her 40s with this feeling of, why out of the blue and all of a sudden do I feel anxious when the evening time comes and I can't sleep anymore, right? That's what showed up with her symptoms. You know, things hadn't changed. It wasn't the pandemic yet, so not all of us were anxious all of the time. Life was pretty stable, but it seemed to be out of the blue where she started to feel more anxious and have trouble sleeping. And we see that a lot. So in doing the testing, the progesterone was really low. And then we could replace that and things got better. So we'll talk more about that as we talk about replacement. So how do we test? There are lots of ways to test your hormones. You've probably heard of Everlywell. Everlywell is an online company. They first kind of got popular with a test for food sensitivities, but they're a company you could just order. I was looking at it today. You could order a perimenopause test kit for $99 that tests your hormones. You do a drop of blood at home and put it on there. The thing I would say about that is that could be a little bit helpful, and it could be a starting place, and it could give you some information, but then what do you do with that? So still, I think if you want to get tested, you could do that at home, but I think you're going to want to talk to your doctor about that. And you could talk to your primary care doctor, you could talk to your OBGYN, you could talk to an endocrinologist, but your primary care doctors and your OBGYNs, they're used to testing hormones. We think of it mainly as blood tests, but we also test hormones with saliva tests and with urine tests. The urine test can be really helpful, especially when you're on hormones, because it shows the breakdown products of some of the hormones. And so if we're having trouble getting something right, the urine can give us a clue into why maybe a hormone replacement isn't working. The hormones really are interrelated. And so if thyroid is off, we have a hard time getting your estrogen and progesterone normal. And so often we'll be testing kind of multiple hormones at the same time. And then I would say lab tests aren't the only way, or they're an important part of it, but they're not the only part of it. And so this is a little bit, you've all had conversations with your doctors, and I will share that this is a little bit an area of controversy inside the medical community is kind of the approach to what does your number being in the normal range mean? If I'll use the example of testosterone in men because it has this super wide range of normal. So a normal testosterone in men goes from 260 to 960. And so the question is, if someone comes in and they have the symptoms, the physical symptoms of low testosterone, and their number comes in at 270, so it's just above that lower threshold, is that someone where we should replace that testosterone? And there are people who say yes, and there are people who say no. You know, part of that, I guess where I come down on that is a lot of times I think being in the middle of normal is the place where we're sure things are going to work the best. And so if someone had no symptoms and they were kind of low normal, I don't think I would replace that. But if someone's having symptoms that are really consistent with that and they're just inside the normal range, then that's something where I think it's worth trying and being open to seeing if that works. So just something to think about, because levels can be pretty wide. We see that with thyroid as well, that the levels can be really wide. And the question can be, where do you feel better inside that normal range? You know, our normal ranges are based on, here's where 95% of the population fell within these two numbers when we do the lab test. But that, you know, that's a pretty wide spread, and everybody's a little bit different. And so that may not be where you feel the best. Lots of things can affect hormones. This is a pretty limited list, and I don't think, but obviously with age, we will all, over the period of our lives, produce less and less hormones, which also raises another question, which I think is interesting, is the question of, so since that happens, is that normal, and should we do anything about it? Or, you know, thinking this, and I see this in patients all the time, is that feeling of kind of, if that's natural aging, then I'm gonna let that happen. The other way is, hey, if my body works better with more of this hormone and I feel better and there aren't risks to it, then I think that's the other way to look at it, is say, hey, my body works better with these hormones in the normal range. I'd rather keep those up for as long as I can in a safe, healthy way, so that my body functions at the highest ability. There are medications that affect hormones and will disrupt hormones. Obviously, there are illnesses or genetic disorders that affect your production of hormones or your breakdown of hormones. You know, type 1 diabetes, you know, we'll talk about later. That's an illness where people stop making insulin, right? And it affects everything. And so luckily, you know, a long time ago, they were able to replace insulin, probably one of our first hormone replacements, that saves, you know, millions of lives. Stress can disrupt hormones, diet, other hormones. So like we talked about, your thyroid being off affects everything else. Exercise affects it. Exercise, we always think of exercise as positive. There is, you know, sometimes exercise in women, and there are lots of studies that show that intense